Continue talking about your health. Cancer doesn't stop even in the middle of a pandemic. Two doctors in the Valley have created a new program, the first of its kind in Nevada, that focuses on rectal cancer. Here's more information.
Welcome to the show, Dr. Boyer and Dr. Bartocciolo.
Thank you very much.
Yeah. So let's first start off by introducing yourselves and your specialties to everyone.
Sure, I'm Dr. Bartocciolo. I'm an associate professor of surgery with UNLV Medicine, and I'm the chief of colorectal surgery. So primarily, I'm treating patients with their surgical treatment.
Yes, I'm Dr. Boyer. I'm a radiation oncologist with Genesis Care, formerly known as 21st Century Oncology. And I've just come to the Las Vegas area about a year and a half ago after spending 24 years in the United States Army, most of which as a radiation oncologist.
Tell us some of the issues that we're facing in regards to rectal cancer.
If we think about a cancer such as rectal cancer, it becomes really complex because so many specialties are really needed to treat a patient. Again, we're talking about surgery, chemotherapy, radiation treatment, and it all adds up. So that is really the complexity to tackle a cancer this complex. And through a lot of research, it's been established that the care is lacking in a lot of areas throughout the United States. So first was a little bit of gathering data, but then all the national leaders decided to do something about it. So the next step is to say, all right, we're going to really go through, come up with criteria, how to make it better, and then build up programs. And it's an official national program, the accreditation program for rectal cancer by the American College of Surgeons.
How do you think this program can actually change lives in regards to rectal cancer?
Well, I think this program being accredited by the American College of Surgeons, patients aren't going to have to leave Las Vegas to get the best care for their rectal cancer. They can stay right here. They'll get the care that's on par with that they would get in Los Angeles, San Francisco, Phoenix, and more. So it really offers the patient state-of-the-art cancer care. So it's not only going to lead to improved outcomes for patients, but I think they'll have a better quality of life for it.
With the pandemic going on, what's your advice, Dr. Boyer, to people who are at higher risk for rectal cancer?
But the bottom line with rectal cancer and with all cancers, the earlier the better. So while we do see a light at the end of the tunnel with these vaccines that hopefully will be starting soon, you absolutely must not delay your cancer screenings. All cancers are better treated the earlier they're detected. And if you detect a cancer early, perhaps you can be cured with surgery alone and you won't need radiation therapy or chemotherapy. But the longer you wait, the more advanced the cancer gets and the more therapy, and the less our chances of curing you and or the more toxic therapy will be.
For more information and to find locations near you, call Genesis Care. The number is right there on your screen, or visit genesiscare.com. Las Vegas Now will be right back.